Hey everyone, so this right here is our quick intro to our online learning platform for home health agencies, home care companies, and hospice agencies, where you're going to be able to get access to our online university providing your home health agency, your home care, your hospice agency, training for your marketers, for them to have all the skills and tools needed to be able to market your agency. Now, just to let you guys know, Home Health Success Academy has two websites, right? The first one is homehealthsuccessacademy.com, and that is our strategic consulting company. And within that, you'll be able to find out so many different things about our organizations from what we do, as well as additional services that we have. Now, we have our online marketing university, and in our online marketing university, that will take you to our 10xpatientreferrals.com website, which is this website right here. Now, within the 10xpatientreferrals.com website, which is our online university, you'll be able to have several choices. So we have our silver, gold, and platinum membership. Just to let you guys know, these possibly will be changing soon, but the price will be somewhere in the same, with a little bit more or better offerings. Now, it doesn't matter which one you choose, you will have access to our full online university, whether it's a silver, gold, or platinum. The only difference is that in the platinum and in the gold memberships, you will have additional things as well for you guys, such as your quarterly mastermind meetings, as well as your monthly coaching that is included in that. So moving forward to that, when we go and log into our courses, you just have to click on the top right hand corner, course login. Typically, if you're not logged in yet, you will be asked to enter your username and password. Once you have that, then you can go down here and look at the three different options. Just to let you guys know, like I said, there's going to be some changes because we are offering some of the individual plans eventually. But once you access here, you just have to click to which one that you subscribe to. And so let's say, for example, you subscribe to the Gold Marketing University. When you click that portion, you will be brought into your site area. And within the site area, you will have all your different courses down here. So you'll have your cold calling techniques. So if you go to your cold calling techniques, for example, it'll bring you to the particular page for the cold calling. And what you're going to have here is the full training resources. It's the part 1 and part 2 of your cold call training. Now, why is cold calling important? Well, guess what? A lot of people out there is going to say, hey, cold calling is dead. It doesn't exist. It doesn't work anymore. And I will tell you one thing is that everybody else out there does not know who you are. And there's a 70% more chance that you can actually increase the closing rate for a potential referral source if you actually have an appointment before you walk in, meaning you're able to walk in with an appointment so that they're ready for your presentation, so they're already set to be open to the discussion about working with you. And so that's where the importance of having a cold calling techniques are. To be able to know how to get past the gatekeeper, to be able to know how to leave a message, to be able to know how when you get them in front of you in the phone, how do you have the conversation with them and have the appointment setting skills for that. And so we always tell people that one of the best things to do when it comes to marketing is that you get ready and do a lot of cold calls. And like I said, there's a lot of people out there who's going to say, hey, cold calling is dead. It doesn't even work anymore. That's fine. But I'll tell you one thing. Some of the best marketers out there, the ones who are successful, those are the ones that are willing to make cold calls to make these appointments. Now you have your closing scripts and skills. Great access to this one, right? So in the closing scripts and skills sections, the main purpose of that is you need to be able to close. There's one difference between they like you, they like your presentation, but if you cannot close, if you cannot get them to seriously say yes and give you that referral, meaning the close, or say yes, right, and close a deal to be able to provide non-medical private duty services, there's nothing that you're going to get, because guess what? There's going to be people that's going to say, hey, you did a great presentation. Leave us your brochure, leave us your business card, and we'll give you a call when there's a patient that comes in. That's just them being nice. And so how do you know that you actually did a good job? You got the referral. Countless times we're going to hear from a lot of agency owners, agency marketers, that are going to say, hey, you know what? They said they love my presentation, so they come back to work and they high five each other, but then months later comes in, month, 2 month, 3 month, even a year, and nothing. There was no referral. And that's because they weren't able to close. And just to let you guys know, closing happens in multiple different variations, right? You close to get the first referral, but you have to continuously follow up to get more closes later on, to get more referrals. The Creating $1 Million Agency setup is for us to be able to give you the quick training so that you guys are aware what you need to do to create that $1 million agency. Because if your agency is not making at least a minimum of $1 million, you're not going to last that long, right? Because you have to understand the agencies that make $1 million, that's just your gross revenue. After you pay everybody else, you have to look at the cash flow of the product of the company that you guys have, whether it's a home health or non-medical. And so in this video series, we share with you guys, what you guys need to do to create that $1 million agency. And so if you guys keep on scrolling down right now, this is an 8-part completion setup. And so watching this is such an important thing. Now, look, this is not just for the owners or administrators. This is for you marketers as well. Because if you guys cannot get your company to create wealth, to create a high cash flow, what ends up happening is your company can close down and you can lose a job. So it applies for everybody in the office space that they understand that they need to create a $1 million agency. Now, the do's and don'ts in marketing. Great place as well. What we did here is that we wanted to be able to share with you guys what are the do's and what are the don'ts that you know when you guys are marketing your company. And so if you guys see here, 1, 2, 3, 4, 5, we have 5 complete courses here. This is such an amazing thing that you guys should definitely get into. Now, fraud in the home health is another series that we are so it's actually one of my favorite series here. And the reason for that is we're starting to see a lot of fraud happening in the home health industry, in the healthcare or companies industry as well. It's just all over now. It's very rampant. And a lot of the reasons why a lot of agencies actually are committing fraud is because they're trying to find the easy way out, the easy way to make money. And there is no shortcuts when it comes to actually creating a successful legal agency out there. You have to be able to understand that there are illegal billing practices, right? Whether it's Medicaid, Medicare, or insurances. You have to know that, using independent marketers can cause problems for your company. Having a home health recruiting physician, right? So you have to look into that as well. And so there's a variety of different things that you guys should definitely look into this. And this is actually, knowing the law, knowing what you're not supposed to do will actually keep you in the straight path for your organization. Now, moving on to handling objections. Handling objections is another great area that you should pay attention to in this training program. And the reason why that is because you're going to face a variety of different objections. Whether an objection is when you're trying to call a place to get in, they're going to try to do what? Not let you to speak to the person you want to speak to. Now, there's also going to be objections that you're going to face when you do your presentation, objections when you're closing, objections, when you're following up, right? They may say, we still don't have any patients. Or, when you're doing your presentations, they're going to say, we're already working with another agency, but I don't mind hearing out what you have to say. And so there's a variety of different objections, and being able to handle that is what you need to do. So we will go through the whole home health marketing objections during your sales process, all throughout and everything. So if there is anything else, this is another part that you need to pay attention to when you are in our online university. Okay, moving on. Marketing challenges, of course, these are things that you will face. There's so many challenges in the marketing industry that you're going to have. And so you have to know what the challenges you're going to be put against and to know how to be able to handle that. Now, within this series, we have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. You guys see here 12, 13, 14, 15, so many videos here that's going to be important for you to be able to go through. Now, I'll tell you guys one thing. There's over 200 hours of audio and video training that we have in our online learning platform. And the funny thing is we're adding more this month as it is. And our goal is to be able to add more content every month as much as possible, especially in our mastermind section. Okay, so Moving on to marketing secrets, there are a lot of secrets out there. It's funny as I get a lot of phone calls sometimes for some marketers or some agencies that will tell me, hey, Michael, you know what, can you please stop sharing some of the things you're sharing with because you're giving out our secrets? And I told them, I said, well, obviously, if I know these things that you do, it's not really a secret. And I don't know you, never met you, never saw what you do. And so you guys have to understand is that there's a lot of these things that a lot of agencies know that other agencies don't, that most agencies or marketers don't want to share. And because of that, I wanted to be able to make sure that I have an open spot here that I can share all these information with you guys as much as possible. Now, here's another one as well, our monthly strategy marketing tips. So what happens is we will give you guys strategy tips every month. So for November, this is what you should do. December, these are great things you should do. January, February, and so forth. And you'll have access to that all throughout the year, okay? Prospecting strategy. You know, before we actually go out there and start marketing our organization, we have to first prospect who are the people that we want to actually target. So the prospecting strategy gives you guys that training from our intro sections to be able to, you know, creating home care programs, creating new programs, researching your market, geographical targeting, phone call and leaving a voicemail, email prospecting, prospecting using print media. So all these different things right here are great when you are trying to begin the stages of your marketing. You want to be able to prospect first. The strategy in marketing is also another great area. You will learn all the small strategic items that these are things that you should get into place. You guys have to understand marketing is not just about going out there and going door to door. And the worst part about it is some people just kind of wing it. They don't have a sales process, they don't have a plan. And that's what's going to cause problems with your marketing is that you have to have a plan in place. You have to have a measurable plan so that you can go back and say, hey, where are we failing or where are things that we can improve upon? Okay, so let's go ahead and get into the creating specialty programs. So, you know, whether you're a home health agency or your home care company, what makes you guys stand out? Now, if you're a home health agency, obviously, you know, you guys take care of a lot of clients with cardiac problems. You have a lot of fall risk clients that you handle as well. And so a lot of the times these are just normal things that we do for our patients. But what you can do is you can actually say that you have a specialty program, a specialty fall prevention program. But you know, the last thing you want to do is just say, hey, we have a specialty fall prevention program, but actually don't have a step-by-step process on how you implement your fall prevention program for your clients. It's important that we prevent them from falling, right? Because if clients fall, they end up in a hospital, they end up in a nursing home, and they're not under our care anymore. So you should start learning how to be able to create all your variety of specialty care programs. For home care, non-medical, you should have a fall prevention program anyway set up. And what are the things that you guys are actually doing to help prevent that client? So I've shared this several times where, you know, in the Midwest, our home care company and home health agencies, but especially our home care company, we provide what we call free snow plowing. We plow the driveways of the clients that has homes or lives in a townhouse. We also shovel their driveway, right? Why do we do that? We want to prevent falls from happening in their house. Now, we may be taking care of, for example, Janet, who's the grandma, but and she needs a lot of help because she has dementia, she has Alzheimer's, and if she's walking out, she may have a fall. But she, of course, the fact that we're taking care of her, she has that difficulty on taxiing and moving. But her husband, at the same time, that lives with her, that we provide care for, his wife, could have an accident, and we also want to prevent that. So by us offering this additional specialty program service for this couple, the family members are more likely going to want to use our services because we actually offer the shoveling, the shoveling of the driveway, the walkway, and the family may typically have to hire somebody else to do that for them, or sometimes they want to do it, but they're not there. And so we hire and outsource it to a particular company and say, hey, how much are you going to charge us to plow the driveway, plow the walkway when there is at least a minimum of 1.5 inches in the ground that falls. And so these are things that we create, but like I said, we do this to make ourselves stand out. And at the same time it's not snowing every day where it's going to cost us money. It may snow maybe 4 or 5 times of 1.5 inches and above in a month during the winter season, but it makes us stand out. And so there's a variety of different specialty programs you can actually implement in your company. And in this section right here, specialty programs, we're going to share with you guys all the different types of specialty programs you should actually have in your organization, that if you actually start doing this, you can use this as a marketing strategy to make yourself stand out in the community. Now, this right here is probably the most important section, which is the follow-up techniques, right? You must have a follow-up system in place. So this is going to detail to you guys how we follow up, after we make the initial contact, after we have the first meeting, after we have the first referral. So many different in-depth following up techniques and training that we give you guys here. If you follow this part and hold it into heart and create a wonderful follow-up technique process, you'll be amazed how more referral sources you're going to start to convert. Getting in the hospital list is one of the most important things. That's the first step in order for you to be able to start getting referrals from the hospitals. And this right here is probably one of the hardest things to do, but we're going to give you guys some of the tips that has allowed us to get into the hospital lists in our areas and has been implemented by other agencies that we actually work with. Habits of a great marketer. When you hire a great marketer, look at the habits of a great marketer. And this is something you should assess with whoever you're hiring or a person that you already hired for your company. And then from looking at the habits of a great marketer, we're going to share with you guys our techniques on how we hire marketers in the field. What questions should you ask? It shouldn't be, do you have experience in home health services? That should right there not be the only thing, because if they do have experience, why are they trying to get another job? Because if they're doing what they're supposed to do and they're doing a great job, the company that they're working for is going to really try to reward them and keep them on board. And so, one of the things that we ask people is that when they get hired, I ask them, why do you think that you're going to be a great marketer? It's a great question to ask. Why? And then what are you going to ask them is three things. Number one, I'm going to share with you is this. If a physician tells you they are already working with another agency, what would you respond? And if that marketer cannot have a response within 1 second of asking that question, and they have to think about it, I will guarantee you that they're going to have problems in the field. And they're going to need training from you guys. And if you guys can't provide the training, that's what the resources are for the 10xpatientreferrals.com, is to provide training for marketers, whether they're experienced or inexperienced, whether they have experience in sales and marketing, but not in the home health industry. That's what this 10xpatientreferrals.com website is for. Now, moving down, home health marketer orientation. This is probably, if it's a new marketer in the industry, you want them to get into this set right here. So it's a more basic overview of the whole process of home health and home care services. Marketing giveaways is also a great one. It gives you pretty much over 40 videos, and we add more and more videos as we go through the months. It gives you ideas on what you can give away to potential referral sources when you're marketing to them. Of course, keeping the costs of your marketing very low. Marketing mistakes, always good to know what type of mistakes that I've faced and other marketers have faced. And so it at least gives you a guidance so that if you start seeing it, you may not have to face it yourself, or know how to get around the problem and those mistakes and not to create it yourself. Marketing motivations, this is just a video series that, sometimes we need extra motivation, and that's what that series is for. Nursing home marketing, this is us sharing with you guys how to be able to get into a nursing home. What are the strategies? How do you approach your marketing? How do you walk in? What should you have? That's a good thing. Sales process is the first video that you guys should actually watch in this whole series. You have to assess your sales process. You must have a sales process that exists in your organization. And if you don't have a sales process, this is going to continuously have problems for your marketing strategies. For nursing, for example, and since I do have a background in nursing, one of the things that we share with nurses and nurses should learn is what we call the nursing process. And the nursing process goes with the word ADPIE, A-D-P-I-E, meaning assess, diagnose, plan, implement, and evaluate. That's how we know and we can look at what we're trying to do for a particular patient. It goes the same exact way with home health marketing. You have to have a sales process created so that the whole team, both management all the way to the bottom line of the company, knows what they need to do in every single process. Now, the seminar samples, we'll have videos from, old seminars that I've done in the past, and we'll put clips of great ideas that you guys can actually listen to. Some of the information in that clips you can probably find all throughout the program. But it's just an additional resource so that you can see myself and my team going out there and actually training other agencies and other agency owners and marketers, administrators, and so forth. And the last one right here is called the shortening the sales cycle. So if you have a sales process, right, the shortening the sales cycle is a way to kind of get around the sales process to shorten its length on each side. So, once you have your sales process in place, then you can watch this one right here. But don't jump to shorten the sales cycle. A lot of you guys are going to want to jump to this because you're going to say, hey, I want to shorten it right away, because we always try to find the easy way out, the more easier things. And you can't shorten the sales cycle if you don't understand your sales process. So these right here are the videos right now that is within our 10xpatientreferrals.com website. But I'm going to tell you guys right now, we are actually adding more lessons to this. We have our online campaign, which is pretty much your Facebook marketing and Instagram marketing, and how Facebook can actually help you gain more clients and more referral sources. That's going to be adding soon. And every 1 or 2 months, we're going to be adding more information in this training program just to be able to add more value for you guys. All right. So that pretty much right there is the basics of what's going to be included in our 10xpatientreferrals.com online marketing university. So we can always go back to the main website right here. And when you go to our main site, it's just pretty much the overview. So if by now that you haven't registered, that's perfectly fine, but I truly suggest that you should. Like I said early on, this right here might be gone by then. We are readjusting our rates. The people that have signed up already will be able to keep these rates, but we will try to get them to kind of transfer over to our new rates. And to the new programs so that they can see and add more value for them. But all I can say to you guys is that you guys should truly, truly, truly make sure you take advantage of the 10xpatientreferrals.com website because this is seriously the only website, the only company out there that provides you guys additional resources right on the palm of your hands. You can view this through your phone, your laptop, through your tablet, through your desktop computer. You have full access to this. This is the only company that allows you to be able to have a month-to-month membership and access to over 200 videos and audio items that's going to be able to give you guys everything that you need to market your home health, your home care, or your hospice agency.